Hello, this is Dr. Jack Berg with Montana Chiropractic and Nutrition. Welcome to our pre-care class, the class designed to give you the opportunity to learn more about the type of care that we offer here at our office and help you to make the decision whether this is the right place for you to be to get your health care needs met. To tell you about myself, I grew up here in Billings. I've been practicing here in the Billings area for many, many years, almost in my 19th year of practice, so I have a lot of experience in helping people to get well. And we have very experienced and caring staff also. So this video doesn't cover everything about chiropractic, but hopefully give you enough of an overview about chiropractic and about expectations that we have for you, as well as expectations you may have for us, and see if those match. Sometimes patients come into our office and is seeking some sort of care that we really don't offer, or they don't really seem to be committed to getting well, and so we want to make sure that it's just a right fit for both of us. The motto for our practice, as you can see from this slide, it's your life, live it healthy. And that's our whole goal, is we want you to be healthy. The problem that we see in our society is individuals and families are seeking health and vitality in ways that are just completely contradictory to becoming healthy. They're living with lives with nerve interference, which is interference between the mind and the body. They have chemical interference, meaning there's just so many toxins all around us, in the foods we eat, the air we breathe, the water we drink, everywhere, and that's really making us sicker and sicker. And then people are striving to find health via unnecessary drugs and surgery that just really only treat the symptoms versus really alleviating the problem. And then the standard American diet is just devoid of most nutrition that is really has any kind of life-giving properties to it. So part of our mission is to help people learn how to eat well. From this slide here, it talks about our overall purpose is to change lives in individuals and families by removing nerve and chemical interference, meaning those things which are interfering with the body's ability to heal itself. We also provide inspiring education and leadership in health restoration and wellness principles. We want to teach you the truths and principles that will help you to lead a healthy and happy life. This is called a healthcare continuum, and this slide really has just great information in it. I think that if you just understand these concepts, this alone will help you to be a healthier person. So we see on the continuum at the top slide, left-hand part of the slide, that you see optimum health. That means everything in your life as far as your health is working 100% perfectly, and you're just living a life of vitality. At the far right end is death. Well, most patients are not coming into our office with optimum health. They may have that goal. We have many of our patients who are striving for optimum health, how to improve their health and vitality, and we help to work with them in achieving that. No patients are coming into our office dead. So somewhere in that continuum between optimum health and death is where patients are coming into our office. So we can see this first step down from optimum health is there's physical, chemical, and emotional stress. I mean, that's everything around us. So oftentimes we think of stress as just being emotional stress that comes from our jobs or our relationships. But there's also physical stress from poor posture, to poor eating, and not exercising, being sedentary, sitting at a desk in front of a computer. Smartphones and devices just are wreaking havoc upon our physical bodies. But then also there's chemical stress, again, from foods we eat, the air we breathe, and water we drink. And of course, emotional stress. As that amount of stress exceeds our body's ability to adapt, it leads to the next step down, which is called subluxation complexes. That's an area of neurological spinal tension and put your body in a state of dis-ease. Not disease, there's no disease yet, but it's out of ease or lack of harmony within the body. And the body is not adapting appropriately no longer adapting appropriately to stress, and is starting to affect your health. Then the next step down is asymptomatic pathology, meaning you start to develop a health problem, whether that's a back problem, a neck problem, digestion problem, or a heart problem, or whatever. You're starting to develop that, yet there's no symptoms yet. Then the next step down, when that is there long enough without being corrected, eventually you're going to get symptomatic pathology. Now the health condition has progressed to the point that you now have symptoms. But so you can see, in asymptomatic, somebody may feel good, but they're not necessarily healthy. A more extreme example is somebody who feels great, goes in for a routine physical with their medical doctor, and all of a sudden is determined through testing that they have cancer. And that yet they feel good now, but eventually as that cancer progresses, they're going to have symptoms. Another example is tooth decay. By the time you have tooth pain, well, how long have you had a tooth problem? And those analogies, those health conditions, and how they progress are very similar to back and neck pain, which is a lot of the reasons patients come in to see us. Well, by the time you get a back pain or neck pain or any kind of symptom like that, that usually has been going on for a long time. You've been neglecting your spine and health to the point that now you have symptomatic pathology. And then, if you don't take care of your health, then eventually, we're all going to die, but eventually you're going to die maybe prematurely, or your quality of life is going to go down rapidly. So our whole goal with patients is to help take them, either they come in with asymptomatic pathology or symptomatic pathology, or help them to get back to optimum health. Now, chiropractic does not treat any disease or condition. Our job is to remove nerve interference and whatever's interfering with the body's ability to heal itself. And this will be explained more on this slide. There's some fundamental axioms of health, being healthy, and how the body works. Number one, the body is self-healing and self-regulating. God created the body to be this way. The next point there is the nervous system, your brain and spinal cord and all the nerves, is the master controlling system of every other system in the body. The next principle is that any interference with the nervous system, since it's the master controlling system of the body, if you have interference with the nervous system, you're going to have interference with your body's ability to self-heal and regulate. The next step down is, and I said this back in that slide, but I just want to review it again, getting unhealthy is a process. Rarely does somebody come into my office with an acute event. They may think it's an acute event because maybe some sort of symptom started recently, but generally, as I talk to the patient, they start really being honest with themselves. They realize, I'll say, how long have you been having this back pain, for instance? Oh, about a week. And I said, never had any before? Well, I started noticing something about 6 months or a year ago or a couple years ago or 5 years ago, but it just kind of went away, so I just kind of ignored it. But yet the problem was never corrected, so it continually progressed. Now, the final one is getting healthy is a process. Getting unhealthy is almost always a process. Getting healthy is always a process, meaning it's a process that takes time. You can't go from asymptomatic pathology up to optimum health and well-being with an event. It takes a process, and usually a process of doing several good things right to become healthy. So you may want to review this slide again. That's really important. We'll be talking about it when you come in to be a patient in our office. Well, how are we able to check a patient's nervous system? If the nervous system is the master controlling system of the body, which it is, we have the technology to assess your nervous system, and we use this CLA's insight scanning, which is a non-invasive way of assessing how is your body handling the stress in your life. Is it handling positively or negatively, and how is that impacting your health? And this is just great tools, and you'll learn more about that. Again, it's non-invasive, it doesn't hurt. We can run these tests on children and adults, it doesn't matter. But just to explain in a nutshell what it does, you have a horizontal core. Often we hear about this, about our core muscles, which really extends from the front around to the back, that helps to stabilize our body. But you really have a vertical core, and that's your spine and spinal cord. And with this CLA's insight scanning, we're able to check the integrity of that vertical core, and we eventually get a score out of it. And so here's again what it measures. It's the baseline measurements of the state of your core neurological and spinal functions, again the vertical core, and it gives us a score. Between all the tests we run with this technology, it gives us a core score, kind of a number, a grade, between 0 and 100, how you're doing as far as your neural efficiency, and determine how stress is adversely affecting your health. Then with this core score, this initial testing that we do, this baseline testing, we're able to track your progress with future tests, which we generally do at 4 weeks into care and at 8 weeks into care, and then ongoing every 4 weeks in your care process. This is how we can measure progress even in the absence of symptoms. So meaning you get to the point where your symptoms are gone, we're able to continue to assess, are you improving under care? Okay? And then we use, if we determine you have that those areas of spinal neural tension, which we call subluxations, we have a wonderful technique called torque release technique. This is a state-of-the-art technique that's used to determine exactly where in your neurospinal system are you having those areas of tension / subluxations. And our practice members just love this kind of care because it's safe and it's gentle. We use an instrument called the integrator adjusting instrument. This is the integrator adjusting instrument. This was developed out of medical studies that were done in the early 1990s. It gives a very safe and precise type of adjustment to basically retune your spine and nervous system and help it to move towards optimum health. We don't do twisting, popping type of adjustments, and there's nothing wrong with that kind of adjustments. That's just not the kind of adjustments we do. So if you're really seeking more of a manual, vigorous type of an adjustment, this isn't the office for you, and you can call our office, and there's some chiropractors here in the Billings area that will recommend that you can go see. They use the same CLA technology, that Insight Station technology we use, and we can refer you to them. But our practice members love this because of its precision. They're not sore after adjustments, and they get great results for their whole family. I mean, we can safely use this instrument on small children all the way up to the very elderly. Now, for infants, we may still use the torque release analysis system, but we do even more gentle, like ounces type pressure adjustments for, say, an infant or a toddler. Very safe, very effective. And there's an article on our website under new patient paperwork that you can go to see, read an article more about torque release technique. And again, it's the only way I adjust my family. It's how I get adjusted. There's another chiropractor in the Billings area that uses torque release technique, and that's who I go to. I could go to any chiropractor in Billings, but I go to him because he offers this kind of care that my body responds to beautifully. There's some we talk about side effects of medications. You see these drug ads on TV, and they always show somebody smiling as somebody in the camera is talking really fast, explaining all the side effects of those medications. Well, chiropractic is very safe, very effective, and it has some very positive side effects. I mean, patients often come in with some sort of symptom or health complaint, but then they notice some other really good things improving as we take away that neurological tension. One, they notice more energy, more vitality. They can handle stress better in their lives. Because that's what chiropractic really does. It increases your body's ability and capacity to adapt to stress in appropriate and healthy ways. Patients also notice improved mental clarity and focus. And I notice this too when I get adjusted. After I get adjusted, my brain just seems sharper, and I'm able to make decisions better in my life. And you can just review that list. There's some of the great things on there, how it affects children. A lot of our pregnant practice members, these women just love chiropractic care during pregnancy because they can safely alleviate some sort of health complaint that they're having during pregnancy without the use of drugs. And we can safely work with your OB-GYN and to make sure you're getting the appropriate care during your pregnancy. And you can see some great things that happens with children as far as bedwetting and colic. Not that we treat diseases or conditions, but again, we focus on helping the body to self-heal and regulate. And I really love the bottom one. Our practice members say when they get adjusted, they're able to be more active in their lives. And that has so many other good health effects when you're able to be active. Okay, so here, just to give you an overview, if you decide this is the right clinic for you and we accept you as a practice member, there's really 3 phases of your care. The first phase is called release phase, meaning because most patients and practice members have neglected their health for years and years to the point where they get now symptoms or we call symptomatic pathology or health complaint. We have to release some of those old negative habits that you built up in your neurospinal system, that axial core. And that can take a while. A good analogy is let's say you have a jar of peanut butter and the lid gets screwed on crooked, right? Well, the first step is not to start to crank down his teeth trying to screw that lid on because it's on crooked. But first you have to release the lid, unscrew it, then put it back on correctly. So maybe a simple analogy, but I think it's visual and helps me to learn it. But we need to release those old negative habits. And that starts with an initial 8 weeks of watchful progressive care. Meaning, what does that mean? Well, we're going to see you 3 times a week for a total of around 24 visits. Children are usually half of that. But so it depends on the case and how long that child has had their problem. They may need just as many visits and checkups as an adult. Progressive care means every 4 weeks, at the 4-week mark after you start care with us, and at the 8-week mark, we're going to do that initial testing that we did to make sure you're progressing under our care, okay? And just a side note there, insurance is only going to cover generally part of release care. Just because, as you know, most people's insurance benefits are less and less, and we have many, many cash patients in our practice who have no insurance or underinsured, and there's great ways that we can make that affordable for you if you're committed to getting well. The second phase is now we have to rebuild your neurospinal system to build new and stronger, healthy habits, not only in your neurospinal system, but in your life in general. Our health goes bad because of the way we've lived, okay? And so it's really important that to rebuild that can take a long period of time. It can last 8 to 12 plus months of watchful progressive care to really get you to the point where you've really developed some good, healthy neurospinal habits and lifestyle habits. And that's definitely not covered by insurance, but you can ask about our payment plans and we can definitely make care more affordable to you if you're committed to getting well. The third phase, which we won't cover much today, is just called Revitalize. I mean, we're trying to grow and improve your health. We can be here as your health coach to help you to grow and progressively get healthier and healthier. Okay, so here's some expectations we have of practice members. We know you have expectations of us, so hopefully as you watch this video you can determine if we meet those expectations. Of course, if the video doesn't cover everything, you have some questions, you're welcome to call our office or email us at info@mymontanachiro.com and ask any questions you want before starting care. But here's the number one expectation we have for all of our practice members. You need to take, and this is very serious, so pay close attention, you need to take 100% responsibility for your own health and getting well. It's your job, it's your responsibility. I'm here myself and my staff are here to assist you and work with you, but it's your responsibility. It's not your parents' responsibility, it's not the government's responsibility, it's not the insurance's responsibility, it's your responsibility. And I just found the patients who take charge of their health and are committed to getting well get well faster. So we can't do the blame game about our genes and our family and stuff like that, because in most cases, health problems are not genetic. You may have a genetic component, but almost all of that is all genes. Most genetic conditions are activated by lifestyle, meaning I may have a genetic predisposition for some sort of neurospinal problem. But that isn't necessarily going to happen, but it depends on the way I live my life, okay? You need to commit to a minimum of our 8-week starting plan of that initial examination, and then the care for 4 weeks, then the progress exam, then care for 4 more weeks, and another progress exam. And so if you're really not committed to really committing to that basic minimal starting level of care, then this is definitely not the right office for you. And we'll be happy to, again, make some other recommendations for chiropractors to see. But most chiropractors really want you to be committed to getting well. If you're just looking for patch-up care and just kind of putting a Band-Aid over your problem, well, you know, there's other offices you may be able to find, but most committed, dedicated chiropractors really want to focus on correcting the cause. So we expect you to see you 3 times a week for those 8 weeks, and we expect you to pre-schedule based upon what your schedule allows all of your visits up through that first progress exam at the end of 4 weeks. Patients love being able to do this because it allows them to lock in the times that work best with their schedule, and then they're committed to care, versus patients who come in and they're just going to schedule as they go. Well, often they miss out on the times that they want, they get filled up, or life just gets in the way and they get distracted and then they wonder why they're not getting well. Follow all of our home care instructions. Often practice members will come back to me after we've been seeing a while, and I'll ask them how they're doing on their home care instructions. They'll often say something like, well, I'm trying, or not as good as I should. Well, I'm trying and not as good as I should is going to get you so-so or not even mediocre results. Okay? So home care is very important. Come to all of your appointments open and ready to healing. We have a group adjusting area, meaning it's an open adjusting area with multiple patients in a room, usually 3 patients in a room being cared for. So you need to come into that room, turn off your cell phones, avoid talking, and just relax and be here to heal and get well. And it's a great way. We've just found we did this open type of care that synergy of people in the room all wanting to get well just really does a great job. And so again, it's really awesome. Reduce your daily load of physical, chemical, and emotional stress. And that seems kind of generic or a broad scope, but we'll give you some clues on how to do that and identify ways you can do that to help you to get well faster. Again, it's a team approach. If I'm over here working really hard and you're over here not working so hard, then you're just not going to get results. So you have to be committed. Okay. This slide talks about health insurance versus health assurance. First of all, health insurance is really misnamed. It's really sick insurance. Insurance is there when you're sick. Generally, it doesn't do much for you to help you to stay well. It may catch, sometimes insurance talks about prevention, but mostly prevention is wrapped up into catching problems early, which is good, but I'd rather not catch a problem, but prevent problems from ever occurring in the first place. And our philosophy for many of our practice members and myself is don't delegate or give responsibility to your health to anybody else. Not the government, and not your insurance company. Okay? Health assurance focuses on doing all you can to raise the level of assurance that you're going to stay healthy and be healthy, both for you and your family. And that comes through the chiropractic care that we offer, as well as the lifestyle choices that we can help coach you through. So build your health assurance. That's the more important thing. And we want you to do that because we want to, when you're done with care with us in the release and rebuild phase, that if you choose to see us after that in the revitalized phase, that's totally your choice. But that's all about building your health assurance. Okay. Here's what you need to do to get started. You already watched the video. It may be good to watch this more than one time or watch it with a family member to make sure you understand what's going on and the expectations for you. Especially that expectation slide. You may want to go back to that one. Complete the video survey. There's a survey that goes along with this. It's right under the new client paperwork that you see on our website. Fully completed. So you have to watch this video and fully complete the survey. Really give some thought to those questions that are asked in there. That's just not busy work. That you're going to be bringing that to your first visit. So if you come to your first visit, you haven't completed that survey, we're not going to see you. So before you can discuss your first visit, you have to complete the survey. And this, of course, you watch this class, which you're now almost to the end too, but you've done that. There's other paperwork that you'll need to complete, and that's located on our website, our new client paperwork. Complete it all the way. Don't leave any lines blank. If something doesn't apply, put NA on the line. Don't skip anything. And then bring to your first visit, if you have any recent x-rays or MRIs or blood work or any doctor's notes to help us know more about what's going on with your specific health complaint. So just those records that pertain to your health complaint, which you're coming to our office for. Get copies of those if you can ahead of time. That's just really critical. I like to have all the information in front of me before I decide if I'm going to accept a case or not. And of course, it helps me to make the best care recommendations for you as far as care frequency and as far as what I want you to do at home. To your first appointment, again, wear firm-fitting shoes and loose, comfortable clothing for some of the tests that we do. It just makes you more comfortable. Your first appointment lasts about an hour, so make sure you schedule plenty of time. We don't want you to feel rushed, and I definitely don't want to feel rushed. I want to take plenty of time to ascertain what your problem is and what the best way is to help you. And this final point is critical. We are a healthcare clinic. We're about changing lives in individuals and families. We are not a credit union, and we're not a billing agency. Okay? So all of our clients and new practice members are required to keep a credit card on file or an electronic funds transfer on file to allow you to make payments, okay? So that way if we hear back from your insurance company and if it turns out you owe something, then we can just take care of that. So again, we're not into chasing people around. That's not what we do. Our focus has to be on healing, okay? So that's really important. And there's a form you'll sign on that when you come into our office. But if that's not something you are willing to comply with, then this is definitely not the office for you. Okay. Now let me just close by sharing one story about chiropractic care. And this story has great meaning to me. This was a patient who had fought, I believe it was Afghanistan, and had been severely injured over there. He came back just a mess. And he went through the entire VA system as far as all the care and tests, and they couldn't do anything for him. And kind of as a last-ditch desperation, he decided to try chiropractic care. And he came into my office, and we ran tests, and I said, "You've definitely got those areas of neurological tension called subluxations that only chiropractors are trained to correct. Let's try some care. I don't know how well you respond, but if you're willing, let's try. So we started some care, and he started to notice immediate results and then gradual getting improvement over weeks and months, to the point where now he was able to function again in his daily life, able to work. Of course, his self-esteem improved as he was able to work and be active and take care of himself. And again, those people that protected our country, we just owe a lot to them. That was just one of those great cases where nobody else could help him, but we could. And so chiropractic is powerful. It's especially powerful for those who are committed to getting well. It's your life. Why not live it healthy, full of vitality? Thank you, and I look forward to seeing you in my practice.